We're here today for a checkup.
Está aquí hoy día para un chequeo.
Sí.
Down at the Family Community Center, I am an interpreter in Spanish. I interpret for the doctor and the nurses so that they are able to understand, and then for the patient so that they can understand. So that's my role right now.
Yeah.
Well, when I first came back from Peru, I wanted to continue my Spanish. And this was the first opportunity I had because Sister Martha mentioned it to me, and I thought, well, you know, if it's a way that I can keep up with my Spanish and still serve, then that's why I wanted to do it. So I shadowed her as an interpreter for a couple of days. And I saw that we work as a team there, with a nurse practitioner or a doctor, the provider, and the scribe, and the interpreter, and the patient. And so I felt very comfortable. But then all of the other aspects came out of it that I didn't realize would. And I still stay with Wednesday, Thursday, and Friday morning from 9 to 1. And I know most of the people on the teams in those times have many change, but they come and go. But still, it's a good time. So, and I do keep up with my Spanish that way, and I appreciate that.
Okay, one.
I worked 15 years down in South America.
And that's good.
When I first went down there, the first 2 years, first of all, we were sent with no Spanish. I couldn't say hello. So, but then the first 2 years I was down there, I got hepatitis. Was put in the hospital. I, at that point, was not very fluent in Spanish. Could not understand what the doctors were saying. Had no idea what I had, first of all. And one day, 3 doctors came in hovering over me, and 2 nurses talking away. I was completely dumbfounded. What are they doing? What are they saying? What's wrong? I had no clue. I was there for a week. And I said, if I ever get out of here, and if I can ever help somebody in this condition, believe me, I will do it. I feel by doing this work of interpreting for these people who come in and do not know English very well. They might have a spattering of it. Some of them have been here longer, some of them have just arrived. And they need doctor's help, but they don't know how to ask for it. They don't know if the doctor understands them. The doctor can't understand them. So I feel that this is an important work because it helps them to feel more relaxed. When the doctor goes out to write prescriptions or whatever, I can talk to them. And if they haven't understand exactly what the doctor was saying, they'll say, what did he mean by this? Or what did he mean by that? Because I went through it. So I know the feeling of helplessness, of not knowing exactly what you're saying, or what the doctor's saying, or the nurse is saying. And what does this mean? I find that, yes, very comforting too, that I can be a part of that. So that's my big thing. And a secondary thing, I keep my Spanish up.
Que sí la conoce, ¿no?
Aquí en la clínica.
Sí.
Yeah, they knew each
I
other.
kind of see the hand of God in this ministry, because I'm just so grateful that I've been working there for a few years now. And they need, they are our sisters and brothers in our global community, and they need us to help them to feel welcome in our country, because they are needed in our country. They bring so many gifts, and so I just feel fortunate to be able to be one of the people who can help them at this time. And also, our clinic was founded to serve the underserved,
It's a free clinic. It's everything. Everything is volunteered, but the staff. There's four staff people, and they're paid, but the rest are all volunteer. You cannot have insurance
Okay.
because nothing. You don't have to pay anything to go there. Medicine, if we have it, we'll give it to them. Their X-rays, their blood stuff is all. We pay for all that.
Okay. All right. Okay.
I don't know what impact I'm really making. I know I get along very well with the staff. I've got a name down there, Cool Martha. So, the staff is very good to work with. And the people who come to volunteer, it's amazing. Doctors and nurses who are retired now, who come there and give a day, sometimes 2 days.
The teamwork, I guess that's what I appreciate so much. That one helps the other, and the whole atmosphere in the family community clinic.
It's like a little family. And especially on the days you work, you get to know this person much more than some of the other ones. But it's like a little family. You know their life at home, and you share that. And, I found that very invigorating, very enlightening. And it gives me something to look forward to. So, and it's nice that you're retired, but you still can contribute something.
And we pray, of course, for each other, and I can just see a family atmosphere, and I think the clinic is well named, Family Community Clinic, and we definitely work with the community and for the better of the community.